So I'm Ingrid Brindle, and I'm a patient, and I do lots of patienty things. I'm chair of our Horton Thornley patient group, and we've won an award for the most outstanding patient group in the UK. And I'm enormously proud of that, and I tell everybody, because I think sometimes people think that PPGs are about people sitting around with tea and biscuits moaning about they can't get an appointment. And to be recognised for doing a lot of outreach work, I think is very valuable. I also work with the Patient Online team. I'm a lay member at the Royal College of GPs, and I'm also involved with Health Innovation Manchester. So I do a lot of things like that. I'm also like a proper patient in that unfortunately I've got lots of experience because I've got wretched health situation. Might help you to know a bit about that. I've got ankylosing spondylitis, which is an autoimmune rheumatic disease, which means my body's trying to lay down calcium. So my joints are fusing, so my spine's fused and my ribs are fused and some of my other joints are fused. My foot's trying to fuse at the moment, so that's a bit of a problem. And it also causes, can cause atrial fibrillation, which I have, which is a heart arrhythmia, which can be an important factor in strokes if not controlled properly. And so my experience of the health service is wide, and I've fairly recently lost the sight in my left eye and my right eye is not brilliant. So I have difficulties, but you see, to me, I'm not just a patient. I'm not a patient. I'm not defined by that. And I think it's important to remember the holistic nature of the patient. You know, I'm a mother, you know, I'm a partner, I'm a sister, I'm a carer, I'm a designer, I sing, I do all sorts of things. And I could be your mum or your granny or your sister or anybody else, or I could be you. You know, we are designing these, you know, whatever systems we're designing for real people. And I think we need to bear that in mind. So I wanted to talk to you about information and how having information really helps me manage my health. I also want us to remember that whilst the techie stuff can be fantastic, the human relationships side of it is very, very important, and often is the thing that makes it work or not work. Information's one thing, but patients need medical professionals who are willing to work collaboratively and who are willing to share information in both directions and involve patients in the decisions, in the discussions and in the decisions. We call that in our practice the partnership of trust, and it works very well for us. I'm very fortunate because I've had full online access to my GP records since 2006. That's everything, that's free text, that's coded information, that's absolutely everything. In our practice, we now have over 65% of our patients signed up for full online access, which is incredible really when you think about the fact that the national figures that are put out around about 2-3% of patients having full access. Okay, so I've got access to free text, coded information, documents, letters, test results, and all that, you know, all that stuff. Anything that's held at the GPs, I can see, which is excellent. And it was really important for Dr. Hannan to facilitate that because he took over the practice from Dr. Shipman. Dr. Shipman used to be my doctor, and I thought he was great, you know. If he didn't murder you, he was great. So Dr. Hannan, what Dr. Shipman used to do was he used to go out and murder people, and then he used to go back to the surgery and he used to falsify the records. So it's really important for Dr. Hannan to allow the patients to see absolutely everything that was written about them so that they could start to build the trust which had been very severely damaged. And actually, when Dr. Hannan applied, he didn't even realise which practice he was applying for. He didn't know where Hyde was. He just thought Cheshire sounded nice. So that'll teach him to pay attention in geography, won't it, actually? So, he's been a great advocate for allowing patients access to their information. People talk a lot about patients having access to records, but in my experience, they don't actually always know completely what that means, and often think, patients are sitting at home at the kitchen table reading about when they were poorly, and not using it as a living, breathing tool to manage their health. So I thought it might be useful if I run through some of the things that I can do with having access to my records that help me very much manage my health. And one of the first things is I have access to the information about what my doctor's written when I've been in for a consultation. Now, I'm sure we all know that under situations like that, you retain about 10%, if you're lucky, of the information in an encounter like that. So if I can read stuff when I get home, then first of all, I can remind myself of what happened. I can look at what my role is in the future. I know what the doctor's going to do next, and if there's any medication, it will be written down there, so it's really clear. So it's keeping me safe. The other thing I can do is I can read all my consultants' letters from the hospital. They are supposed to send them to you, but they don't always. And there again, it's a similar sort of thing. I can read what's been written. I can understand what we've talked about. If I've got any questions for clarification, I can get those sorted out. And very importantly, I can use the letters to inform other consultants. I can print them out and use them to talk to other consultants who don't understand what's going on with me. I've had 7 consultants at one hospital at one time, and none of them talk to each other. So they've no idea when I go to see somebody what's been prescribed or what. And that to me is so simple. I should be on a list of all the consultants, and when anybody sees me, it should go ping into everybody else's inbox to say, Mrs. Brindle's been in, this is what's happened. And it wouldn't need to be extra work. It could just be sending the letters that they send to the GPs, but that doesn't happen. So it's very useful to be able to take the information in. It's also very useful to be able to have access to my test results. I have monitoring blood results, and very useful to see how things are going. And they're written in a very simple way. What's being tested, what's the range, what your result is, abnormal or normal. Dead simple. And you can monitor to see how you live is affecting what's happening. If you look at the background to most of the things that I can do, patient safety is very, very much in there as the background to most of it. Because I have had situations where the consultant letter hasn't been right. But my doctor doesn't know that, do they? Because they weren't there. I was there, but they weren't. So having access to what's been written is severely important. It's also useful because I can check referrals. If I've been referred somewhere and it's getting on and I'm not sure anything's happened, I don't have to ring the practice because I can just go through and check, and I can follow stuff up myself, which I have done. A lot of these situations allow me to sort things out without needing to contact the practice. Also very useful to have a list of significant problems with extra information if necessary. I can also order repeat medications with just a few key pressers. That's fantastic. Latest statistics suggest that 50% of prescribed medication is taken incorrectly. And quite a chunk of that is because patients can't get hold of the medication when they need it. So that's a severe issue, both financially and in health terms. So I've got access to all my medical information from a GP 24/7, wherever I am in the world. So that is absolutely amazing when you think about it. Wherever I travel, I take my information with me. Just log on to my laptop or my phone or wherever it happens to be. And of course, if I am in a clinical situation and people need information, I can just show it to them on my phone in the UK or abroad. I think a good story actually is when we were in France a few years ago, and with my atrial fibrillation, sometimes it kicks off and I have to decide whether I've got to go into hospital, the local cottage hospital in France. So what I did was I downloaded my 2 most recent cardiologist letters, got a friend to translate them into French, so that when I went into the cottage hospital where they don't speak English, why should they, they're French, I had all the up-to-date information in French for them to use. I mean, when you think about it, that's, that's quite amazing. We have a patient whose child had severe haemophilia and needed a lot of special attention at nursery and school. So she downloaded all the letters and the test results and the information to make applications for various things. Would have taken forever. I keep asking the practice for that, just so simple. Another person, Margaret Rickson, who was in her 80s, she's one of our flagship people. She went down to a pre-op investigation and she has COPD. And they said, we haven't got any of your records, so you'll have to go home. She said, I've just trailed all the way down here with COPD. She said, to tell you what, I'll show you my records. And she showed them the information. Can you believe that? Just amazing. The technology is there. It's the attitude sometimes, I think, that aren't there. And Yvonne broke a shoulder and she reckoned that counting encounters at £20 per encounter, she saved probably about £200 for the practice by not needing to contact them. And this comes through over and over again. You don't need to contact the practice, you don't need to contact the practice. So it needs setting up at the beginning, and there are implications there, but it reaps the rewards later on. I think it's ridiculous that most patients can't do what I can do, especially when they only see the doctor possibly 2 hours a year. So, I mean, I'm a chronic case, so perhaps I see doctors like a day a year. So that's 364 days I'm home alone. And that's when all the health decisions get made. That's when, we make decisions about what we're going to eat, are we going to have a gin and tonic or a cup of tea? Are we going to go up the stairs or use the lift? What are we going, all the health decisions actually get made when we're home alone. So who needs the information? And I think sometimes you change it into real life, it becomes really stupid. Imagine you're given a project, your line manager gives you a project and they say, this is the most important project you will ever do in your life. So I want you to do it really well. I do have a lot of information that will help you, but I'm not going to show it to you. So you have to manage without it. And you can ask me some things if you want to, but it's not very easy to get me, on the phone or get an appointment. But you can ask me if you want to. So off you go then. You'd say, don't be ridiculous. Don't be ridiculous. How can I possibly do that? Because actually self-care is now, and always has been, the most important part of healthcare. It's about what we do. People sometimes say things like, who makes people well? Oh, doctors make people well. No, they don't. People make people well. And it's really important to, keep that at the back of our minds. So access to GP records is great, isn't it? But it's only part of the story. My information hub should have all my health and social care information. So it should have my inpatient information. It should have my outpatient information. It should have any information from dentistry or physiotherapy or any kind of social care things that I've been referred to. It should be shared between all the people that are involved in my care. And also there should be an opportunity for me to share stuff as well. We were talking before, weren't we, about I'm not just a condition. I'm a person. Actually, when I want you to look at, when I want you to read about me, I want you to read about my life a bit, to know what I can do and what I can't do. It's very important. We need to be holistic. And it's not difficult. I mean, I think in Finland, my understanding is when you're born, you get a number, and that creates a kind of hub, your own personal hub, and all your information gets fed into that, and people can access it. I mean, obviously you have to consent it, but that's, you know, that's not tricky really. And, you know, anybody can access any of your information, so the thing runs smoothly. I mean, when you think about it, people are always surprised when I say, do you realise you can go down to A&E and they know absolutely nothing about you? They start from scratch. They start from scratch. No wonder there are people in corridors. No wonder they're starting from scratch. How ridiculous is that? And it should work further back from that. The paramedics, when they call to me in an ambulance, they should be able to read on the way what might be my situation, and then take that information down to A&E. It's ridiculous that they can't, because A&E start from scratch and they do a load of tests, and quite often they find something presents which isn't anything to do with why you've had a collapse, but then they have to treat it because they've found it, and it's nothing to do. So all that stuff gets bunged up. I mean, it's, when you actually think about it, it's absolutely crackers when the technology's there. Why isn't it joined up? And often patients decide they want to see their information, but the practice won't allow it for one reason or another. And I think often that's a massive misunderstanding from the clinicians about what the benefits are. And I can understand they're worried that if people look at the records, they may find mistakes or whatever. But you see, if you find a mistake in your records, it could be very important. And it's better to find the mistake while you're alive rather than after you've died. But I think it's a big issue about why some clinicians don't want to do it, and we haven't got time to do that actually. There are lots of initiatives from NHS head office about accessing information in a technological way. But I think what's not realised often is that it isn't free for practices to do this kind of thing. You need personnel to organise it. You need people to check that records are okay, to check that patients understand what they're doing. Because it's not just about data, is it? It's about understanding. You know, there are things like that. People need to organise the logistics of people going online and things like that. And this takes practice time. And I think there needs to be a recognition at head office that this needs to be funded. If they're serious about it, it needs to be funded. There needs to be money going into practices to facilitate. And I think that would make an enormous amount of difference. And also to facilitate understanding. But it's not free. It's got a cost too. It's got a cost to practices. It's interesting to see what patients sign up. I think I said we've got 65%, but over half of our Bangladeshi population are signed up and using their online access, because of course they can get help at home. You know, if they can get help from their family, they can get help from their friends, and it's a big support to keep them safe, because obviously lack of understanding, if you're not confident with English, is an issue. We've also got a high percentage of people with learning difficulties signed up. We've also got a very high percentage of people with mental health issues, because and they don't start worrying. It seems to be that they are more confident and secure because they can read stuff and they can understand it better. And on our practice website, quick plug for our practice website, htmc.co.uk. There's just loads and loads and loads of information, videos and ideas and all sorts of things. So we're big on information and understanding, because that's the only way forward. Otherwise, how can you make all those decisions that we were talking about before? What else do I do with technology? Well, I have an implanted heart loop monitor for my atrial fibrillation. Fantastic piece of kit, sits at the side of the bed. Every time I go to bed, it downloads to the heart centre, very big brother, and they receive the information and they process it. Right, okay. So it's a bit strange, because it's a bit like a black hole. They don't tell you if they've received an event or anything like that. So you've no idea what's going on, and then they don't, you know, there's no feedback. I've asked for feedback before and they say, well, it does get monitored. All right, it does get monitored. And if there's anything life-threatening, then we'll be in touch. Oh, good. But that's not just the issue. The issue is my AF triggers 4 different things. So it's very useful for me to know when I've had an event that's triggered, that's sent information down there. So I can think, oh, I wonder if it was that, or does that correlate with when that happened? So that I can put the whole thing into context and look at what might be triggering. So fantastic piece of technology. Here's the conversation. Hello, I wonder if you could tell me whether there have been any events recorded recently. No, I'm sorry, I can't tell you that. You can't tell me that, why? Well, I can't tell you that because we can't speak over the phone. We operate Caldecott principles. Oh, that's great. Okay then. So can you email me some information? No, sorry, emails are not secure. Okay, so could you send me a letter just giving me some ideas of when things triggered and for how long? No, there isn't anybody available to send you a letter. Okay, could I come down? No, sorry, there wouldn't be anybody available to see you if you came down. You have to wait for your next appointment, your next annual appointment. Because, of course, they've no idea what's happening to me. Have they? What's happening when it triggers? They've absolutely no idea. So I went back to my AliveCore device, which works with my mobile phone, which gives me an instant ECG. Again, fantastic piece of kit. Gives me an instant ECG. So if I'm having an event, I can put my fingers on the electrodes and I can know straight away what's happening. So all that stuff, because when I go down to the heart centre, I won't see the same person. And they don't know anyway, do they? So what a waste. Okay, I think what's really important, certainly for the time being, is to reach for the stars, but at the same time, remember that we might have to think about some simple stuff to start with. For example, a sheet of A4 when you go to casualty. You know, that's not a joke, really. We've got some fabulous books that we give out for our practice, which are called My Medication Passports, that allow you to write all your recent information in just an easy form, so that you can give it to whoever needs it. I've recently had a wound on my leg. I've had it dressed by the district nurse for a couple of months now. I haven't seen the same district nurse. So I have been taking pictures of my wound with my camera so that I can show the person I'm seeing what it was like the last time. Why is that not just standard? It's so simple. Why is it not standard? It's just a piece of cake, isn't it? And I'm just working on some medication charts for people who find it difficult to organise their medication, and they're going to be on a piece of paper. Repeat meds, when to take them, any comments about how to take them, so that a patient has a master plan of when to take what that they can use to tick off and keep an idea of where they're up to. Because, of course, 50% of prescribed medication is not taken correctly. That's a massive issue in terms of patients' health and also economics. Crikey, 50% of the prescribing bill of the NHS is not taken correctly. Ooh, that's a biggie. Anyway, there are lots of biggies, aren't there? There are lots of biggies, and we could be here all day. So I'd better shut up now. So I just hope I've given some food for thought and contributed some ideas for the debate. And I'm really grateful to you for listening and taking some time. Thanks very much.